see, I knew it. I knew I was right. There was something wrong.
He just lost all color in his face, almost as if he had aged overnight.
My worst fear was that he wasn't going to live very long.
I couldn't take this amount of pain, and that's when I knew it was over.
We're waiting for the treatment, we're waiting for the diagnosis. Give it to us.
Next, 3 medical mysteries that defied the experts. For over 13 years, dancer Cynthia Toussaint struggled to understand how a simple leg injury could become a source of crippling chronic pain.
I didn't know what was wrong with me. I couldn't even hop on my foot. I was in so much pain. Nobody got it.
Jerry Mara thought he had injured his back, but by the time doctors discovered what was really wrong, he was on the verge of dying.
My life was coming to an end. That's the way my body was telling me at the time.
And Isaac Antilla, a little boy whose simple cough and sniffle turned into every parent's nightmare.
As soon as Isaac came out, I knew something was wrong.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. It all began in the fall of 1991, when Kathy Antilla was 8 months pregnant with her 3rd child.
It was about 2 weeks prior to my due date, and the nurse took my blood pressure and called the clinic and said her blood pressure is pretty high.
The next day, Kathy was rushed to the hospital for an emergency C-section.
As soon as Isaac came out, I knew something was wrong because he was really small and his color was poor.
He was just tiny. His head was as big as my fist. He was just skinny. He was just so thin. There was just nothing to him.
He was so little that we couldn't find socks for him to wear, so he had to wear my doll socks.
During the first few months of life, Isaac was constantly getting sick.
About the middle of October, he already had an ear infection. In November, we ended up in the emergency room, another ear infection, and this time too, an upper respiratory infection, probably bronchitis.
Strep throat, ear infections, pneumonia, everything you can think of that children would get, but he'd get them all the time, and he'd get them repeatedly.
But whenever Kathy took Isaac to get checked out, the doctors didn't think that his symptoms were out of the ordinary.
And they'd say, well, his lungs are clear, his ears are clear, go home, contact us in a few days if things aren't better. And a couple days later, we would be in, and then it would be bronchitis, it would be pneumonia, it would be an ear infection. And you just think there's going to be a day where he outgrows it. Like his brother had ear infections, he outgrew them.
But weeks passed, and Isaac didn't outgrow them.
Month after month after month, there was something. There was always something.
If he could go a week without being sick, that was a huge deal.
Finally, when Isaac was 9 months old, Kathy's pediatrician referred her to a pulmonologist.
I said, I have this little baby. All he does is cough. He's been sick almost every month since he's been born. He spits up all the time. And I said, I'm just really frustrated.
After a thorough exam, the pulmonologist diagnosed Isaac with asthma.
So now I'm thinking, yes, it's asthma. That's why he's had bronchitis and pneumonia, and we're going to get this asthma under control, and it's going to be smooth sailing. So every day, morning, noon, and night, we would, hook him up to his nebulizer, and he would have some breathing treatments, which did help the coughing somewhat.
In addition to asthma, the pulmonologist diagnosed Isaac with acid reflux, which he thought was causing the spitting up problem.
The pulmonologist then started having him take some kind of a medication to help with the reflux, and that helped somewhat.
But neither medication was the cure that Kathy and Dan were hoping for.
He still spit up, not as much. He still coughed, not as much, but he still got sick.
My worst fear was that he wasn't going to live very long, because he was sick all the time. And the body can only take so much, especially a little body like that.
Like Isaac's first year of life, the next 3 were full of ongoing illnesses and frequent trips to the doctor. Then, at age 4, Isaac's vomiting problem became much more serious.
He couldn't even look at food without throwing up. You're sitting at the kitchen table eating, and if he comes and walks by, and maybe the smell or how it looks makes him throw up. He could only eat certain foods, and that was a mystery to me, how somebody could only eat cheese, crackers, peanut butter, and juice, and that's all they would eat.
Every time we went out to eat, we would have to, take the menus and set them up around what we're eating because he would get nauseous at the sight of it.
If this was just acid reflux, it seemed out of control. Isaac's doctor referred him to a gastroenterologist.
The gastroenterologist did an endoscopy where he went down, he scoped down through his mouth, into his throat, into his stomach, and did say, yes, there is, we know there's a reflux problem. Okay, we're going to change his reflux med, and, we'll still do the nebulizers, and this will be it. When he gets a cold, put him on an antibiotic, and we're good to go. And he wasn't. He still continued to get sick, month after month after month.
Since the day he was born, Isaac Antilla had been suffering from continuous infections. Now, at age 4, he can barely eat without throwing up, and his doctors and parents have no idea why.
See, the thing of it is, there were so many things going on with him medically that we didn't know the impact of the one thing versus the other thing. The combination of all that stuff was mind-boggling to me. I didn't understand what was going on.
And neither did Isaac's doctors. The child's condition was so hard to figure out that some experts began to question Kathy's behavior.
Isaac had some trouble breathing, so was kept overnight at the hospital. We were in the room in the evening. The on-call doctor was making rounds. I said, he's always sick, he's coughs, he's always vomiting. And he said, what do you mean he's always vomiting? And I said, well, he's very sensitive to the types of foods he wants to eat. And he goes, well, what if you make him eat a food? What if you give him something to eat? And I said, he won't eat it. And if he does, he'll gag, he'll throw up, he'll vomit. He, in his dictation, wrote, Isaac would probably not be vomiting so much if Mother would not make such a big deal about it. And that, to me, was so enraging, was infuriating, because Dan and I had dealt with a chronically ill child at this point in time. For almost 5 years, almost 5 years we dealt with it. And I would think that if I was a neurotic parent, or I was making this up, that pulmonologist or the gastroenterologist would have picked up on it by now. And I wasn't a new mom by any means. This was my 3rd child. We'd never gone through anything like this with the other 2. I was infuriated.
Doctors could doubt Kathy all they wanted, but no one could deny the fact that Isaac's condition was beginning to seriously affect his development.
I wanted my little brother to go outside and play with me, but when he did, we would start running or playing a game, and he would start coughing or throwing up, and he couldn't keep up with, me or my older brother or other kids his age.
I'd always prided myself in being able to fix and find solutions to things, to problems. A lot of men look at life that way. Oh, this is a problem, I'll fix it. And then Isaac comes along and there's this problem. Well, this isn't like, fixing a door or fixing the car. It was just something that I couldn't fix.
Worried and exasperated, Kathy and Dan decided to try one more doctor. Ear, nose, and throat specialist, Dr. James Sidman.
So I decided the best thing to do would be to put him on a 3-week course of antibiotics by mouth. And when I did see him back about a month and a half later, he looked great. He had just had the 6th healthiest weeks he had had in many months. His cough had gone away, his ear problems had gone away, he wasn't having the throat burning and stomach aches.
He was doing well for a period of time.
And I was pretty proud of myself.
But after 6 weeks, all the old problems came back.
I was just at wit's end at this point in time.
It was then that Dr. Sidman decided to take a step back and review all of Isaac's medical records.
He looked at them and he went, "There's something missing."
At age 2, Isaac had undergone a 2-part test that measures how well the immune system is working. But in Isaac's case, only the first half of the test had been done. Curious, Sidman sent Isaac to an immunologist to be retested.
When I saw them, I could see that they had been passed around, they had been told a lot of things, and I think they've been accused of maybe that they're making up or overreacting to the clinical problems, but Isaac was a very sick boy.
Dr. Shapiro drew Isaac's blood and sent it to the lab. A week later, the results came back, and Shapiro quickly called the Antillas.
He looked at us and he said, "I'm going to change his life and your lives because I know what's wrong with your son." And he seemed so sure of himself. It wasn't, "I think I know what's wrong with your son." He said, "I know what's wrong with your son." I believed him.
Isaac Antilla had been sick his entire life, and no one could figure out why. But after years of false leads, his family had finally found some doctors who thought they had an answer.
He said, "Isaac has a primary immune deficiency disease." And the only thing I could say was, "Do you mean like David, the boy who lived in the bubble?"
Kathy was partly right. The boy in the bubble was born without any immune system, but Isaac was only missing certain components of his.
The immune system has many different parts to it, and it's a complex system that interacts with all of the parts. So if you're missing part of your immune system, you have other parts that compensate.
In a healthy child, the immune system produces antibodies that constantly fight off germs. But in Isaac's case, he was only producing some of the antibodies, leaving him vulnerable to the kinds of bacteria that cause colds, bronchitis, earaches, and stomach infections. The technical name for Isaac's condition is Common Variable Immune Deficiency, or CVID. It's extremely rare, and its causes remain a mystery, but the dangers are clear. In advanced cases, patients are prone to a host of life-threatening illnesses. For Isaac, there was only one hope for treatment.
What we decided to do is to give him replacement of antibody from other people that would give him what he can't make.
When I left his office with Kathy and Isaac, and the weight that was lifted off of my shoulders, it was like now hope was genuinely there.
And I wanted to bring the diagnosis to anybody who wouldn't listen and say, see, I knew it. I knew I was right. There was something wrong.
In 1996, at age 5½, Isaac received his first plasma infusion to compensate for his weakened immune system.
As soon as I got the plasma, there was a feeling that I have never had in my entire life. That was the greatest feeling ever. I felt like a normal kid. I felt like I could do anything.
Isaac continued the treatments, and with each one, the improvement was noticeable.
After a few months of the infusion, it was a gorgeous summer day, and I was outside working the yard, and he came outside with some kind of a snack that he had never wanted to eat before. And he sat on this bench, and he swung his little legs, and he goes, "Hey, Mom, Mom." And I look over, and he goes, "Look at me. I'm just like a normal kid now."
The Antillas were thrilled with finally having a diagnosis, but they could not understand why it took so long to get an answer.
We learn when we're young medical students, there's a term that they teach us, which is to be a lumper and not a splitter. And being a splitter means that you find a different diagnosis that explains each symptom. And a lumper tries to lump them under one common diagnosis. So in Isaac's case, we have him being treated for stomach upset by the GI doctors, the intestine doctors, chronic lung infections by the pulmonary doctors, chronic ear and sinus infections by the ear, nose, and throat doctor, but nobody's trying to put it together. And I think that's why the diagnosis was missed. In medicine, it's always better to be a lumper than a splitter.
Today, Isaac gets antibody infusions every 2 weeks and will continue to for the rest of his life. But as far as he's concerned, it is the only reminder that he was once a very sick child.
Dr. Shapiro is the greatest. He is just the best doctor ever. I am just glad that I could get to him by the time I was just 5.5. Because today, now, I am active. Whenever it's sunny, I'm outside for like hours on end. I'll come in like for about a couple of hours, and then I'll go back outside again.
He does anything he wants to do. And if he ends up getting sick, he takes an antibiotic, and he's usually better in a matter of days. We can live a normal, happy life. He can do what everyone else does, and so can the rest of our family.
Isaac Antilla was clearly sick, even if doctors didn't know why. But Jerry Mara spent years trying to convince people that he was suffering from something real. At 38, Jerry was a healthy and vigorous family man.
I was in full-time construction, building home, doing renovations, and also decided to follow my dream of having an electronics shop.
Then, one day, he felt a strange pain in his side.
The first pain was on the right quadrant, right underneath the last rib. And the pain would focus in that area, and it would go toward my back, and it would be a dull pain.
He will often hold his hand at his side, towards the back, saying that he had this pain.
Jerry had never felt anything like it before, so he decided to check it out.
I remember going to a clinic and did a blood test, and the result was everything was fine.
It would give me comfort thinking maybe it is just a back pain. You worked in construction, you must have hurt your back.
I went to see 2 chiropractors. Maybe you have a slightly out of line vertebrae. I think I could straighten it out and alleviate the pain. Maybe that'll make the pain go away, but it really didn't.
For the next year, Jerry dealt with the dull pain, assuming it was related to working and aging.
People get up with pain every day, so why should it be any different for me?
But when a sudden sharp pain woke Jerry from sleep, he knew something had changed.
The pain was so intense that I was literally keeled over. I was actually on the floor. The pain was so excruciating that I couldn't even get up.
I was at work, and I received a phone call from Jerry. He was at home. He had not been feeling well that night.
Anna Marie managed to get Jerry to the ER, where he was told that the sharp pain was probably due to kidney stones.
But the pain was in the same location that I figured, well, at least now we know what it is.
But much to the doctor's surprise, the blood work came back negative.
Blood test, x-rays, CAT scan, they didn't see anything. There was no stone.
Still, Jerry's experience was so typical of a kidney stone that they told him he must have passed it already.
I trusted the doctor that said that Jerry had kidney stone 100%, definitely.
You're telling me one thing, but you can't prove it to me. Of course, I wasn't satisfied with that.
After several hours, the intense pain subsided, but the dull ache in his side remained.
But it would be deep within the body. And the way I felt it would be, if I were to describe it, it would be like a burn. One day it would be worse, one day it would be better, but the pain would always be there on my right side. And here I am with a lot of stress. I figure it's an ulcer, and I'll change my diet. I'll watch what I eat, maybe it'll go away.
And we thought, he has a sensitive stomach. This must be what it's like to grow old.
I would eat less, stay away from certain types of food that would irritate my stomach. It was deep down in my own mind. My problem was in my stomach.
But the change in diet did nothing to reduce Jerry's discomfort. Then, 4 months later, the excruciating pain returned.
But I remember that one day, I got up and the pain was so intense. I literally tried to knock myself out, banging my head on the corner of the sofa 3, 4, 5 times. Couldn't do it. And then the pain subsided and just went to sleep. And when the day came, 5 a.m., and went back to work. Deep down, I knew something was wrong.
Jerry Mara had been complaining of a mysterious dull ache in his side for months. When doctors couldn't find a cause, Jerry and his family began to think nothing could be done.
I used to, in my mind, think, oh, Dad just has, back pain, like every dad has. For a while, we just kind of were used to it and accepted it as a fact of life.
The dull pain was always there and never went away.
After enduring almost 5 years of pain, Jerry's frustration was starting to affect his family life.
He was a little bit mopey, kind of down, not a very happy person at that point.
Slowly, you would recognize that he would get a little bit more uncomfortable, a little bit more withdrawn.
I was always irritable, always angry. I was frustrated up to a point that I didn't even bother saying anything to anyone the way I felt.
Then Jerry began to experience something new. He was getting weaker.
I knew my strength level, and I knew it wasn't there. I would go upstairs, my heart would palpitate.
He just was not feeling well. He was feeling really fatigued a lot, just tired all the time.
But I do remember telling my doctor, I said, "Doctor, there's something wrong here."
The mysterious fatigue worried Jerry. In March 2003, he asked his doctor to run a battery of blood tests to see if they could pinpoint the problem. When the tests came back, they showed that Jerry's red blood cell count had dropped 3 points.
The answer my doctor told me is you were within margin. And I remember telling him, there's a problem here. That is not within my margin.
I called the doctor and I speak to him, and the doctor says he's worried for nothing. It's fine, it's within a good limit.
But that wasn't my concern. My concern was that I dropped 3 points. I wanted to know why.
At this point, I sort of had it. I'm like, the doctors are saying everything is fine. You keep on questioning everything. You're still in pain. You know what? There's nothing wrong with you.
Well, after a while, we thought not that he was making it up, but maybe he was exaggerating, because everyone has back pain, and a lot of people get kidney stones.
But Jerry couldn't stop worrying about the drop in his red blood cell count.
The worst scenario is I thought I was bleeding internally. And I was saying to myself, how much time do I have?
Emotionally, he was distraught because he was tired of feeling progressively sicker.
I made sure that my personal affairs were completed. Made sure that all my insurance policies were paid up to date. Made sure all the credit cards were paid off. My life was coming to an end. That's the way my body was telling me at the time.
Then, one day in June of 2003, Jerry's on the job when he starts shaking uncontrollably. As his coworkers watch, Jerry collapses, barely conscious, and is rushed to the hospital.
My mom had left me a message and said, your dad's really not feeling well. And I thought, oh, kidney stones. This is kidney stone number, 10? She said, you need to come to the hospital now. You could tell he was in excruciating pain. His face, he just lost all color in his face, and he was almost as if he had aged overnight.
Jerry's temperature was sky high. The doctors, suspecting an infection, ran blood tests.
The hemoglobin count that we see is very low. It's 9. I knew I was in big trouble now. It's anything below 10, he'd become anemic.
Jerry's red blood cell count was dangerously low. His doctors ordered an endoscopy and CT scans to find the cause of the anemia.
I remember the doctor, I was sitting up in my bed, and the doctor, I have good news. So you have an ulcer.
And I remember there was a mini celebration in my family when there was an ulcer. Yay, an ulcer. We could deal with that. That's not so bad.
But Dr. Jenis, a staff oncologist, wasn't satisfied. Looking closer at Jerry's scans, Jenis noticed something unusual hidden behind the ulcer.
His CT scan result showed a mass that was situated behind a part of his small intestine called the duodenum, and it was kind of wedged between that area, his liver, and his pancreas. When you see a mass of that size on a CT scan, that mass is malignant until proven otherwise.
I remember sitting by the poolside with my family, and we got a phone call from my doctor. And he said, we have a problem.
And he said, cancer. It's cancer. And it seemed like the whole world froze for a second. All along, we're thinking it's an ulcer, it's kidney stones, back pains, old age, and then they're telling us it's cancer?
The mass hidden behind several critical organs was a gastrointestinal stromal tumor, also known as GIST. A GIST is a cancerous tumor that grows in the supporting tissue of the digestive tract. If it gets big enough, it can cause pain, internal bleeding, and an ulcer. Left undetected, it could metastasize and kill him.
I could think back at the time when he was sit on the side of the bed and say, "Hon, I'm in pain, it hurts." I regretted that I did not force the issue to go see another doctor, to go see a specialist, to continue searching to see what was wrong with him.
The only thing I could think of, the sad part was, would I see my children get married?
Jerry needed immediate surgery to remove the tumor, but the doctors were worried that the cancer had spread.
The tumor actually had started to infiltrate the liver and was plastered up against the inferior vena cava. And when Jerry went off to his operation, I wasn't sure exactly whether the entire tumor could be removed.
We went into the waiting room in the morning thinking 4 hours, 5 hours, and we were exhausted and we hadn't seen sunlight all day. We never left the hospital, and with every passing hour, we got more and more worried.
After 10 long hours in surgery, Jerry was finally wheeled into recovery. The operation was a success.
At this point, he's on so much morphine and so much medication that he's, in another planet almost. And he turns to my mom and he's like, "Let's make more babies. We have good kids. Let's have more babies." And I'm sitting there like,
We felt that strong that he was gonna live a long time to raise another family.
I remember my daughters come to me and hug me and kiss me. Sorry.
Even though the entire tumor was removed, it will be years before doctors can give Jerry a clean bill of health.
He's 2 years out from his operation already, and that's certainly a good sign. So far, so good in terms of it not having metastasized. Certainly, Jerry is going to need to be monitored for a number of years longer before we're safe and secure and that he's out of the woods with this disease, however.
Jerry now is doing great. I mean, when you look at him, you can even believe that he went through so much.
Jerry's tumor was discovered just in time, but the question still remains. Why did it take so long for a correct diagnosis?
I think the message that Jerry's case illustrates very clearly is that when you have a suspicion about a certain medical problem, that often the initial tests will be negative or will be non-diagnostic. Sometimes you have to repeat tests and do them over time before it becomes obvious what a patient's medical condition might be.
We are very, very close because of this. Most wonderful thing is seeing both my daughters, Rebecca and Christina, getting married last year. What the greater gift can someone give you after such a terrible ordeal? All pain is forever gone. It feels good to have a pain somewhere else.
Though the source of Jerry Mara's pain was difficult to locate, doctors eventually found it. But what if you had pain that seemed to come from nowhere? In 1982, Cynthia Toussaint was a ballet dancer and an aspiring actress in her senior year in college.
Performing is what I lived and breathed to do. It was all about performing. It's what I did.
One day in ballet class, Cynthia had an experience that didn't seem out of the ordinary at the time.
The ballet instructor told everybody in the class when they did that particular stretch to do it over again. He said, "You're high-level dancers, stretch your back out as you come up." I felt a pop in my right supporting leg just behind my knee, in my hamstring. It felt like I had a guitar string in my leg that was plucked and had broken.
For dancers, injuries are par for the course, and Cynthia figured she'd be off her feet for a few days, tops.
She called me and she said, "Mom, I've had an injury, but don't worry about it." She followed that up right away. "Don't worry about it. It's just a hamstring tear." She reassured me that it was okay and she was going to be fine.
But a few days later, Cynthia's leg wasn't fine. It was getting worse.
My leg became swollen and it was discolored. It turned purple. And I had constant muscle twitches in it. So I kept staying off of the leg, which is what I was told to do. But that was horrible for me. I was supposed to dance every day.
8 weeks passed and the pain hadn't subsided. Cynthia tried to work through it, but it was too much. Only 3 months before she was due to graduate, she stopped the rigorous training and dropped out of school.
She couldn't dance. She couldn't do the payload of classes that she had to do every day to complete her course study at that time. I mean.
But Cynthia wasn't about to give up on her dreams of becoming a performer. Despite her constant pain, she soon took a job as an assistant to a magician.
With the job, I was dancing a very light, for me. It was very light dancing. I would have to get to the theater and sort of fake, that I was okay, and I would get ready and get out to that stage and perform.
Between shows, she's wrapping her leg in cellophane, she's putting frozen peas on her legs, she's putting ointments. She used every internal process she could to get out there, and she did it.
I was not going to lose that life for anything. Nothing was going to take that away from me.
But after a year, even the minimal dancing in the act was too hard to bear. It had been almost 18 months since the hamstring tear, and she was only getting worse.
I went to see just about every doctor I could imagine. I started with the emergency doctor, and then I would try to get a referral to, say, a neurologist or an orthopedist.
We would say, doctors, she's still got this pain. She's got this terrible pain that's, it's inhibiting her way, walking and sitting and sleeping, and, they didn't seem too alarmed about it. They just prescribed her some anti-inflammatories and told her to take it easy.
I didn't know what was wrong with me. I couldn't even hop on my foot. I was in so much pain. I just felt like my leg was on fire. And nobody got it.
Then Cynthia experienced another injury.
I was stretching before a show, and I felt a pop in my left leg, and it was just like the pain in my right leg. I could not use either leg at that point. Over time, the pain continued to get worse and worse. I thought I could take anything. I couldn't fake it anymore. I couldn't fake it for an audience anymore. I couldn't take this amount of pain. And that's when I knew it was over.
Since injuring her hamstring in ballet class, the pain in dancer Cynthia Toussaint's right leg has gone from bad to worse, and no one has been able to figure out why. Now she's injured her left leg and has been forced to move back home.
I just remember pain and just being unable to do anything.
Cynthia hoped that bed rest would help her legs heal, but after 6 months, she was completely unable to straighten her right leg. Cynthia's doctor prescribed intensive physical therapy.
5 days a week. My leg was put into a passive motion machine, and I was ordered to keep my right leg in that machine every single moment except when I crawled to use a toilet. And that machine kept straightening out my leg as far as it would go, and then it would bend it and straighten it and bend it. This was a torture device for me.
Physical therapist said, the physical therapy is not helping you. I can't help you anymore. So they dismissed her after 5.5 weeks.
This is fantastic. I mean, I don't know what's going on here. I've never heard anything like this before. I'd never seen anything like this before. I just thought people got better and went on.
Eventually, the pain and stiffness in Cynthia's legs made it impossible for her to walk.
We rented a wheelchair, but that was, temporary because I was not disabled. I was going to get better.
Deep down, Cynthia knew that this had to be more than just a dance injury.
I was tested for lupus. I was tested for syphilis. I was tested for multiple sclerosis I think several times.
Every time we went to a new doctor, it was, maybe this will be it. Maybe this will be it.
Trying something new, there was always hope. There was always excitement.
But time and time again, the doctors told Cynthia there was no reason for her to be in pain. Her injury had healed. There was nothing wrong with her.
Doctors were supposed to heal. They were supposed to know.
And so I would say, where's the treatment? We're waiting for the treatment. We're waiting for the diagnosis. Give it to us.
Unable to locate the source of Cynthia's pain, some doctors began to suggest something less obvious might be going on.
At that point, I was told that I was just making it up, that I wanted the attention.
They're beginning to tell you now this is just all an emotional disorder.
My mother and John told me that the doctor had said, Cynthia never wanted to get well. I knew from the very beginning that this was all in her head.
I think we were all desperate. We were pounding our heads against the wall.
After yet another disappointing doctor's visit, Cynthia's mother broke down.
She got me in the car, and she somehow picked up this wheelchair and was just slamming it against the car over and over and over, screaming, "They don't care, they don't care. My daughter's dying," just screaming things like that.
But not everyone was as sympathetic as Cynthia's mother.
People were definitely falling away. Her siblings began to doubt her because there was no diagnosis.
I became an extremely angry person, and I took my anger out on anybody who stayed. So if my family was going to stick around, they were going to watch me get down on my bleeding knees and destroy rooms.
I remember holding her countless times, holding her, trying to hold her and make it all go away.
That was losing my identity. That was losing everything.
In 1990, 8 years after her first injury, Cynthia and her boyfriend John moved to LA, thinking a change of scenery might help. Instead, Cynthia's pain started to spread.
There was so much pain in my arms. And at first I thought it was because I was just using them too much, and I was, overcompensating for my legs. And my right arm did not unfold.
Soon, the pain seemed to envelop Cynthia's entire body.
John couldn't touch me. I mean, it was so painful. I couldn't take a breeze.
Their new life in LA was turning into a nightmare.
I was now a sole caregiver. I had no family around to help me.
I finally lost all my hope. I did not think I would survive it. The only person who was still with me was John.
And when someone's in pain, you want to pull the pain away from it. I would do anything. I would do it all, and all day long, and then I'd get up and do it again the next morning. My satisfaction was measured by how less pain she felt. That was my objective of every day.
And I was racked with guilt because I thought, here's this wonderful man who has given up everything to be my nursemaid, to take care of me. He had lost just as much as I had. At that point, I came up with the plan of suicide. I had chosen the motel, and I saw which room would be easiest for me to get to, and I just knew I was going to do that. And I was very concerned about the cleaning woman who was going to come in and find me the next morning. I remember being very concerned about her. And it was a matter of, I was always going to do it tomorrow. I was always going to do it the next day. I think that I could only survive one day if I knew that I could get out the next. I mean, I was being tortured every moment of my life, both physically and emotionally.
Former dancer Cynthia Toussaint had lived for more than 10 years with excruciating pain that no one could explain. Her friends and all but the closest family members had abandoned her.
It was like a dark cloud coming in and settling in over this and wouldn't leave. It was dark and cold and terrifying and scary.
But just when things looked their darkest, Cynthia and John had a revelation.
I was reading the local newspaper and it talked about pain. Maybe it was the first time I realized that was what we were dealing with, really, was the pain was the problem. I mean, the pain had always been a problem, but I always thought pain was just secondary to an underlying problem. So maybe that was the first time I realized that maybe pain can be a disease. Pain can be its own problem.
The couple quickly found a doctor in their area who specialized in pain disorders.
I believe the first thing I got from Cynthia was a phone call, and she called me and said, I'm not sure what's wrong with me. Can I come in and see you?
And I arrived at his office for the first time on a gurney, folded up in a fetal position because I'd been bedridden so long.
Well, she couldn't walk. Both her arms, she couldn't flex and extend properly. She couldn't use her fingers properly. Her arm muscles were wasted. The diagnosis for me, since I've seen hundreds and hundreds of cases, was really very simple. If you have pain out of proportion to the injury, for which you have no logical explanation, then it is RSD until proved otherwise.
RSD stands for reflex sympathetic dystrophy. It usually begins with a trauma, like a pulled hamstring, which sets the body's normal pain response in motion. But instead of the pain diminishing, something misfires in the nervous system, and a cycle of unrelenting pain begins.
You've got hyper-excitable nerves in the spine that keep sending messages up to the brain that there's pain.
Once the pain loop begins, it is hard to stop.
It's not like having a tumor on your arm, you operate, cut it off, you're better. This is now a problem that's involved in your central nervous system. And all those nerves have to undergo some sort of change to be completely pain-free.
And then he said, Cynthia, you and I are going to work as a team to make you better. And I thought, yeah, we're going to do that. I liked this guy.
Carden put Cynthia on anti-seizure medication commonly used to treat epilepsy. The drug calms down the nerves in the spinal cord and interrupts the pain loop.
But that's now a standard drug for the treatment of this disease, and that really has helped. And then you do physical therapy, which is key.
And it took me, with good care, 3.5 weeks to go from being completely bedridden to sitting up in my wheelchair and to walking around our condominium for short distances. It didn't make sense. It wasn't logical to me.
After 13 years of searching, Cynthia had finally found a treatment that seemed to be working. With the anti-seizure medications and intensive physical therapy, the pain was kept at bay, and she and John began to live again.
Going to a mall, getting in a car, going down to the park, lying under the trees, these have beautiful, wonderful healing effects in themselves, you know. And so that was a part of her rehabilitation at that time.
It was a time where John and I were discovering each other in a different way.
But Cynthia was lucky to get treated at all. RSD is still a highly controversial diagnosis.
It's only really coming to the forefront in the last 10 years. There are even some doctors out there that don't believe RSD exists.
Many patients who have been diagnosed with RSD complain that their pain seems to be coming from nowhere, leading some healthcare providers to speculate that it has a psychological connection.
It's the chicken and the egg theory here. What happens is first you get the pain, and then you get psychological problems. As I say to people who want to know about the disease, just imagine you've had toothache for 6 months, and it won't go away, and everybody tells you there's nothing wrong with the tooth. You're going to be pulling your hair out. So it's devastating, absolutely. Can't get worse than that.
Discovering that she suffered from RSD changed Cynthia's life forever. Now, 10 years out, she's a new person.
Cynthia has improved for 2 reasons. One, yes, she's starting to get into remission, but 2, she's worked very hard at it, doing her physical therapy, taking her medications, and she's a very strong young lady.
I think her whole attitude has changed, too. I think she's doing different things.
After spending 13 years in excruciating pain, Cynthia has dedicated her life to helping others who suffer from the disease.
We have different projects. We run a national awareness campaign where we motivate people with RSD from all around the country to raise awareness in their own community.
And finally, and perhaps most importantly, Cynthia is back in the world of dance.
I am with choreographing my experience with RSD on a ballerina, and I should actually say it's John and my story because it's a pas de deux, so I'm very excited about it. It gives me absolute joy to be back in the ballet studio working again.